Hi, my name is Dr. Lindsay Bernhagen. My pronouns are she, her, and hers. I'm a lecturer in the Educational Sustainability Doctoral Program at the University of Wisconsin-Stevens Point, and also a consultant for the Wisconsin After School Network. Today, I'm here to talk with you about how to assess the COVID impact by looking at academic, social, emotional, and mental health needs based on the data you already have in preparation for the Department of Public Instruction's ESSER III out of school time grant opportunity. Quick reminder about the ESSER III out of school time grant opportunity. The funding for that grant comes from the American Rescue Plan, a federal plan, and has been allocated by the state of Wisconsin. The project period for implementation for this grant is nearly 2 years long, December 1st of this year through September 30th of 2024. The purpose of this grant is to improve the academic, social, emotional, and mental health needs of students most impacted by the COVID-19 pandemic through high-quality, evidence-based, out-of-school time programming. Applications are due soon. They're due at 4 p.m. Central Time on October 14th. The link for the grant opportunity, if you don't already have it quickly available for yourself, is right there at the bottom of the screen. To complete the grant application, you're going to have to come up with an action plan. And what the DPI is asking for in this grant application are really several very specific components to your action plan. One of the first things that you're going to need to do is a needs assessment and a root cause analysis. Basically, identifying what is the problem based on data. And also, as part of that, identifying a target population and priority areas to focus on in your grant application so that you can make the request in a really specific way. Subsequent steps, which you'll learn more about in other sections in this webinar, are SMART goals and action steps and evidence-based interventions. In the section 9 of the grant application, they ask you for your plan. They ask you to articulate your demonstration of need. So what's your data around the need that you've identified? What's the likely root cause contributing to the need to be addressed by this grant project? So basically, what's going on with that population that you want to target? And then to define your priority areas to address the root cause of the need. So how are you going to look at all of the challenges that the students, the kids in your programs might be facing and say, this is the most important thing to do? The way you're going to do that is with data. A couple of tips from the DPI webinar. You can find a webinar from them about filling out the grant application on that website that I shared with you just a moment ago. There's a YouTube video. They say, remember that the demonstration of need is not to show your need for grant funding, because of course, everyone needs more money, right? Everyone has great ideas about what they would do with more money. I'm sure no one at DPI is saying that out-of-school time programs are overfunded. So yeah, of course there's need. But what they're asking is to identify the needs that you have at the local level. So within your specific programs, within your specific sites, your specific collaborations, right? That's really, they want you to get really specific that you're going to address by this grant project. They want you to use local data and engage with a variety of data sources. They want you to show how COVID-19 impacted your students and families and where and how this project, whatever you propose to do with the funds, is going to address that impact that you've identified. So they're asking you to do a needs assessment, basically. Generally speaking, a needs assessment is, and I stole this definition from, attributed though, of course, the State Support Network Needs Assessment Guidebook, which is linked on one of the resource documents that you have. A needs assessment is a systematic examination of the gap that exists between the current state, so where you are now, and the desired state of an organization. Where do you want to be? Okay, so it's identifying where are we now, where would we like to be, and also understanding why does that gap exist? So not just identifying the gap, but really digging into what is the nature of that gap, right? What needs to change in order for that gap to close? So why would you conduct a needs assessment? To identify, understand, and prioritize areas that need intervention, and to provide deeper understanding of a need or of that gap, to help point toward the most relevant evidence-based intervention strategy. So in short, in other words, the purpose of a needs assessment is to understand the problem before you start pitching and experimenting with solutions. It's going to help you make a really educated guess at what kind of solution is going to make the most sense, is going to have the most impact, is going to get you as close as possible to that desired state. So how do you determine the needs, or what does that mean relative to this particular grant? Well, you only have a couple of weeks to get this done. The webinar that I mentioned states really clearly that you do need to identify how the COVID-19 pandemic has impacted students, what students have been impacted disproportionately, that's a pretty key piece there, and then be prepared to address it with academic, social and emotional, mental health, and overall wellness strategies in an out-of-school time setting. So the two questions you need to answer, looking at the data that you have, are who are you going to serve, which subgroup of students or their families, and why? Why have you picked that particular group of students or families? What is the nature of their gap of the COVID-19 impact on that group disproportionately? What can you tell us about it specifically related to academic performance, social and emotional health, and mental health? That's really the key. Those are the key three areas that this grant process is looking at. And to that end, being really specific, I'm going to target this very specific subgroup of students for this very specific reason. Here's all of my data that tells me that we've got a problem here, makes for a really strong narrative in your application. That's the kind of thing that gets funded. That's just good grant writing tips in general. The more specific you can be, the easier it is to really sort of focus, tell a good story, make a strong case, and then also to track the impacts of what you've done. So given the extremely short timeline that you're on to do this, there's no time to launch a full-throated, complex, multifaceted needs assessment like you might do as part of strategic planning or something. You're going to need to look at the data that you already have access to. So you need some who data to answer that first question, who are you serving, and some why data. What is the need that's been identified? So some data sources that you might consider, that you might have access to, and this is just the brainstorm list that I came up with. I'm sure you can think of some other ones. For who data, you have student and family profiles, right? You know who your students are. You have a sense of what are some of those subgroups that might be facing challenges. And you also have probably a fair amount of why data. Why? What are the indicators that there's an issue here with our students? What do we know about our students? What do we know about their academic performance, about their social and emotional skills, about their mental health and their well-being? What do we know about that already? There are a couple of things you can look to. Attendance at school or attendance at your programs. You can look at grades. You can even disaggregate perhaps by discipline. Oh, we saw a major drop off in middle school STEM performance for this particular subgroup of students. You might be able to do that if you have the data sources available to you, or if one of your partners can provide that data to you. You can look at mental health referrals, incidents of mental health issues or use of mental health services in your area, in the school districts. You can look at discipline and behavioral records and get some data around that. So what have those things ticked up? Are there particular groups where we're seeing issues? Are there particular kinds of behavioral incidents that are becoming more common? You might look at participation, whether that's participation in your programs, participation in other extracurriculars, if you can get access to that information with a partnership or a collaborator, or even level of participation. Oh, we had this particular family. We used to have 3 of their kids in our programs. Now it's only 1 kid. I don't know what's going on here. Or the caretakers, the adults in this family used to participate in some of our adult-facing programming. We don't see them anymore. That's all data that you can pull in. That's going to give you an indication that there's some kind of gap, there's some kind of problem, there's some kind of negative impact that we can probably attribute to the pandemic, given what we know about how the pandemic has radically shaped human behavior. So Some things to think about are how can you refer to any formative assessment data you have, just sort of what are you keeping track of, any summative assessment data you already have. So looking at the end of a year, at the end of an intervention, any of those kinds of things and saying, how did that go? What do you already have on hand? And I can't emphasize this enough, but also check with your stakeholders and your collaborators to see what they know, what data they have, and what they've noticed. If you ask them what they've noticed, they might give you a pretty good insight, a little bit of a tip off on how to best identify specific problems, and you can start digging at the data for those. The next important thing to do when you're working with data and trying to make a strong case for why you need money is to triangulate and disaggregate. So before we get to those specific things, let's talk a little bit about mapping data indicators to specific needs. So you'll need to think through this specifically for your programs. What makes the most sense? What data do you have? And what might an analysis of that data tell you about the specific things, the areas identified in the ESSER III grant process, those academic needs, social and emotional needs, and mental health needs. So if you're going to look at academic needs, you might track something like grades and attendance. What data do you have around grades and attendance for your students? If you're going to track social and emotional needs, if you got a sense that's where you really have some work to do, you've got some problems, COVID was really tough on students in terms of their social and emotional wellness, then you might look at participation, you might look at disciplinary or behavioral records. If you're going to look at mental health needs, think about what data can give you insight about the mental health status of your student population as a whole, or even subgroups within that population. You might be able to track mental health referrals, use of mental health resources, attendance, participation, and disciplinary and behavioral records. All those things might hold some key insight into the nature of the gap, of the negative impact from COVID. So what do I mean by disaggregate? In order to make a strong story, to write a strong story about a specific group, right, the who, you're going to want to disaggregate your data by subgroup. And you're going to know best which subgroups are most present, most relevant in terms of understanding the situation for your program or programs. So as an example, let's say you've noticed we've got a social and emotional wellness problem among our students. Okay, we look at all of our students and we're going to track specifically, we chose the indicator here, it's disciplinary and behavioral incidents comparing post-pandemic, or at least post the height of pandemic life change to the pre-pandemic days, 2019. You might say, wow, if we look at all of our students, we see that there's an 18% increase in behavioral incidents in 2021 compared to 2019. Okay, we know we've got a problem there. Let's disaggregate this by subgroup. Let's look at the groups that we serve, the marginalized groups, the underserved groups. A couple that come to mind, particularly thinking about different parts of Wisconsin, are students who are from families who have low socioeconomic status, students who are from rural areas, students who are underrepresented racial or ethnic minorities, or students with disabilities and their families. So if you compare all of this data, you disaggregate by subgroup, you might see something emerge like did in my made up data here. Okay, yep, low SES students and their families, rural students and their families. Yeah, we're seeing an increase there as well in terms of disciplinary and behavioral incidents in 2021 compared to 2019. It's more than students as a whole. If we look at the entire student body that we serve, is it a lot more? That kind of depends. We look at underrepresented students. Yep, also an increase there, but it's actually less than overall students. So probably not a super strong case to make that you want to have some kind of social emotional program aimed at underrepresented students based on this data, because this data tells us, at least this one very specific data point tells us, probably not a super strong need there, but wow, look at that number around students with disabilities. There we see a 30% increase in behavioral incidents in 2021 compared to 2019. That is a lot more than the average across all students of 18%. That's more than 50% higher than that group. That's probably something that we need to take a look at. That's a good story to tell with your data. This is a group, a subgroup, a who that really needs an intervention. I also want to note when you're disaggregating to keep in mind that these population subgroups often overlap. If you have the resources and the data to do it, you may even cross-reference and say, let's look at our low SES students and families who are also students with disabilities, and you can even zero in more. You might not have a population size where that would make sense, but identity is complex, right? So there's certainly the option to do that if that makes sense with who you're serving. And the second trick in making a good story out of your data is to triangulate your data. And what that means is you don't just map one data point to the need, you say, what other data do we have that confirms this? That confirms our belief that there's a need of this sort for this particular population. That's triangulating because you've got 3 points, right? The more data sources you can get to bolster your analysis that there's a need, the stronger your application is going to be. So there are data sources we've already talked about. Again, you can be creative. You know better than I do what your program has and what you have access to. So the goal is to look at multiple data sources across domains as they apply to subgroups within your student or family population. So let's say you decided, hey, we know we've got a mental health crisis among the students that we serve. So let's look at the data that we have about that. Like we got a good sense there's an issue. Well, if we look at the percentage of students who are receiving mental health services or referrals last year when we last collected data, all of our students is about 10% of our students. If we look at students who are from low SES families, 17%. Oh, that's a lot more than 10%. If we look at rural students and their families, 15%. Yep, that's more than all students as well. I'm sorry, that box should be yellow. If we look at underrepresented students, also 10%, that maps the average students. Doesn't seem like there are a specific outlier there, so probably not a good case to be made, but that's an intervention that needs to happen right now with these ESSER III funds. If we look at students with disabilities and their families, okay, pretty major outlier there, 20%. That's twice as high as average students. And then if you can map on top of that, the data I showed in the last slide, disciplinary or behavioral incidents, you can see that if we look at rural students and their families, we have what should be one yellow box, 15% of students, so that's 50% higher than all students receiving mental health services, so it's more common in that population, and an increased degree of behavioral incidents for that population as well, relative to all students. So that's 2 pieces of data that are telling you that you have a problem, that are just kind of pointing to the same kind of problem. They're both confirming that for you relative to the general student population. And then if you look at students with disabilities and their families, wow, again, you've got 2 pieces of data that are telling you a really strong story that students with disabilities, 20% are receiving mental health services or referrals compared to all students. Now, there could be a lot of reasons for that. One might be having your care triage and attended to more, and maybe having a care team that's making sure that mental health is a part of your treatment, or maybe it's not, probably don't have time to get into that with this particular timeline that you're working on. All we can say is there's definitely a need there. 20% of our students with disabilities are using mental health services or are getting referrals, and there's been a 30% increase in behavioral incidents among that same population since 2019. Yeah, we have to do something here. This is the population where we see the greatest need. So that you would want to target that, and you can use both of these data pieces to tell that story, or more data pieces if you have those as well. So really, just to tie this in a nice knot, the purpose of the needs assessment, just to remind you, even in this very short time frame, even in just taking a close look at the data you already have and doing some analysis, disaggregating by subgroup, deciding what your data can tell you about academic need, about social and emotional need, and about mental health need. The goal is to map those needs, understand them really well, as best you can, given the circumstances, given the short timeline, so that you can map those needs to relevant evidence-based interventions. That is what this grant is asking you to do. So this is the key step, really making sure you can make the case that you understand why you are focusing on a specific population along one of those specific 3 dimensions: academic, social and emotional, mental health, with the data that you have. There are more steps to the plan. You'll learn more about those in subsequent sessions and videos. So I wish you luck.